On this week's edition of New York Now, as COVID-19 begins to plateau in New York, Governor Andrew Cuomo makes a plan for reopening the economy.
People need to get back to work. The state needs an economy. We cannot sustain this.
We'll have the latest on the disease with Bernadette Hogan, a reporter from the New York Post covering the pandemic. Schools could be closed in New York for the rest of the school year. We'll tell you what that means for school budgets and teacher workforces. And terminally ill patients could soon have the option in New York to end their own life with medication prescribed by a doctor. We'll have the details. I'm Dan Clark, and this is New York Now.
Funding for New York Now is provided by WNET.
Today, the Senate majority will pass
a law prohibiting it, and we will take them to court challenging it.
Making yet another stand for New York and sending a message to the nation.
Welcome to this week's edition of New York Now. I'm Dan Clark, coming to you again this week from the state capitol. It's hard to know what qualifies as good news these days when it comes to the COVID-19 pandemic. The number of hospitalizations appears to have gone down, and the number of deaths appears to have leveled off here in New York State. But that's still about 700 people who die from the disease every day, and the number of hospitalizations is still going up relatively. Governor Andrew Cuomo said this week that the worst of the disease may be over, but that's if, and that's a big if, people continue with social distancing.
The worst is over. Yeah, if we continue to be smart going forward, because remember, we have the hand on that valve. You turn that valve too fast, you'll see that number jump right back. But yes, I think you can say the worst is over, because the worst here are people dying. That's the worst. The worst doesn't get any bad than this worst. And this worst is people die. That's the worst.
The big question on everyone's minds right now is, when are businesses going to reopen again, and will society ever get back to normal? Joining me now to discuss from the state capitol, I'm also here, but she's joining me via Skype, is Bernadette Hogan. She's a reporter for the New York Post. She's been with me at the governor's press briefings just about every day. Bern, thanks so much for joining me here on New York Now this week.
Thanks for having me.
So we saw some inklings this week of how the governor wants to get back to some semblance of normal in terms of the economy, an economic jumpstart. We started the week with this kind of coalition between New York and 6 other states. Let's talk about that really quick. Can you tell me what the plan is here for New York to interact with, I think it's Pennsylvania, New Jersey, Connecticut, Delaware, and Rhode Island, just to get the economy moving sometime in the next couple of months?
Right. So today's news was the governor is going to extend the New York pause order that he started back in March, and now it's going to be extended to May 15th. That's an extension. It has been extended in the past. Originally, it was supposed to be, the most recent extension was to April 29th, but this is in part and parcel in order to give people some sort of confidence, those who have either filed unemployment claims or lost their jobs, one or the other, I guess the same thing. But businesses are very worried about what they're going to be left with. And if people are going to, come back to any semblance of normalcy. Now, this coalition that the governor announced earlier this week with the other states has to do with a regional effort. As you said, New York, New Jersey, Connecticut, Rhode Island, Pennsylvania, and I believe Massachusetts is also...
Right, I forgot about Massachusetts, you're right.
Right, so Massachusetts was added there. But regardless, this is something that the governor has continued to say it's a work in progress. He's talking about the economic engine in line with transit and also schools. So he's basically saying, look, we're not through yet. We still have to figure out a cure. We have to come up with a vaccine, and we have to continue these good practices of social distancing and decreasing the rate of spread. Now, that's something that the governor also was talking about today. It's very difficult to track that rate of infection and how that's spreading. But judging from the models, hospitalization, intubation, and ICU are down. And again, it's a good sign, but that doesn't mean that we're yet in the clear.
And we don't know, so he said New York pause is extended until May 15th. And just to clarify for our viewers, that doesn't mean that business is open on May 16th. This is all kind of being formed behind the scenes, a greater plan to open businesses over time.
Exactly. So the way that the governor originally put into place New York Pause was, okay, we're going to reduce the workforce by 25%, 50%, 75%, 100%. Same way, we're going to we're going to try to get back to normal by saying, okay, what businesses can we continue to keep closed that are maybe not as essential? Like, I mean, I don't know. He hasn't given specific examples, but what can we reopen that won't be as detrimental to the health and safety of New Yorkers, but still allow small business owners, workers to get back on their feet and again, just return to life. Everybody's been shut up in their homes and people are getting anxious. They're getting worried about either dipping into savings or what's going to happen in 3 months. Will I have my business? Will I have my job? These are all questions that are not just New Yorkers, but Americans are asking themselves on a day-to-day basis.
We're going to have this kind of phased-in approach where the state is essentially going to evaluate, and presumably with the other states in this coalition, they're going to evaluate what businesses are presumed essential. Exactly. For me, my personal feelings, my hairstylist is very essential right now. I mean, my roots are crazy. My hair is getting very long, right. But I have to assume that's not going to be on the list of things to come out immediately. Looking forward, though, I mean, we're just a few months away from summer, especially in New York City. We see some of those beaches packed. Do we know anything about the state's or the city's decisions in terms of what's going to be happening over the summer in public places, or is that too far out to talk about right now?
You have to figure out, okay, do we have enough lifeguards to run these beaches? Do we also want to put people in again, unnecessary or not necessary, but non-essential roles? You're leaving a hot, very dense space and going to the beach. That's something that New Yorkers look forward to every single year. But is it doable? That's going to be something that it's on officials' minds.
We're out of time. We'll have to leave it there. But Byrne, thanks as always for coming on New York Now and sharing your insight with us from the governor's press briefings. It's really important that we have people like us there to ask him questions and keep him accountable every day. So thank you so much.
Thank you.
So last weekend, New York City Mayor Bill de Blasio told reporters that schools in the 5 boroughs would be closed for the rest of the school year. That came as a surprise to Governor Andrew Cuomo, who wasn't given any notice that the mayor would deliver that news. Cuomo later called the announcement de Blasio's opinion, saying there's been no final decision on schools in New York City or elsewhere in the state.
There has been no decision. That's the mayor's opinion. I value it. I value Laura Kern's opinion, Steve Ballone's opinion, George Latimer's opinion, but the decision will be coordinated among all of them.
That's added a layer of uncertainty for schools here in New York, some of which were already stressed over their finances. Dave Albert from the State School Boards Association sat down with Karen DeWitt to talk about how schools are coping.
Dave, thanks for joining us to do this. Really appreciate it.
My pleasure.
So the first thing I wanted to ask you is, how are schools coping? They're all closed, and it looks like schools might be closed until the end of the year. I mean, there's not going to be regents. There's a question, will there even be, graduation for seniors who are graduating? How are schools coping with this?
Well, as you just pointed out, there's a great deal of uncertainty right now, and I think it's difficult. I mean, schools are kind of in the here and now right now, which is they're providing meals to students. We have buses, running to homes or to central pickup points where they're dropping off breakfast or lunch for students. We have schools arranging for childcare for healthcare professionals and first responders. And of course, we have distance learning. So that's what schools are doing now. I think they're doing the best they can. In some cases, distance learning has proved to be a challenge. And they're kind of working through things. So we might have a school district set up a Wi-Fi hotspot in a parking lot so they can provide distance learning for students who may not have access to Wi-Fi. So, it's really just a lot of uncertainty going forward and a lot of just living in the here and now, trying to get past some of the challenges that schools really haven't had to face in a very long time.
So nobody's idle right now. What about school boards? Are they meeting? Are they meeting virtually or remotely?
Yeah, so most school boards are meeting through teleconferencing, or some type of, distance meeting. So the governor did relax the open meetings law. So they don't have to have their meetings, obviously, in a public, open, meeting type of setting. So we are seeing boards utilizing telephone, or video conferencing, and that's how boards are meeting.
So spring is usually, in addition to all the things going on in schools that aren't going on right now, it's a big time for school budgets being put together, being put before the voters. New school board members are elected. That was supposed to happen the third week of May. That's not happening now. It's been put off till at least June. What is the status with that? Is there going to be school budget votes at some time this year?
Well, to put it frankly, we just don't know. The governor is going to decide whether there'll be votes and what form they'll take through an executive order. We know that, as you pointed out, we're not going to have either board elections or budget votes on May 19th. The earliest we could have them would be June 1st. We don't know what the date will be because the governor hasn't set a date yet, or what form it would take. We don't know whether the governor would allow boards of education to adopt their budgets this year, similar to the way that a locality might adopt a budget, or whether there'll be absentee ballots. We're seeing that now. I believe the governor announced that there's a June 23rd date for other types of elections, which could be done through absentee ballot. Nothing yet on school elections, on school budget votes. So we just don't know. That's one of those areas where there's a great deal of uncertainty.
That's right, June 23 is the state and federal primaries. But I guess the bigger question is, how are schools going to make a budget? You didn't see any increases, of course, in the latest state budget, but you didn't see any declines. School funding was held flat, but there's no guarantee as the year goes on that you're going to get that money because, as we all know, there's almost no money coming in. So how do you go about making a budget for the year?
Yeah, it's proving to be very difficult. So we did see flat foundation aid. So the same for the current school year is carried over to next year. At least that's how it is for the time being. And that is largely because of the federal stimulus, which provided about $1.1 billion for K through 12 education here in New York State. So were it not for that, we likely would have seen a cut in education aid. So we're thankful certainly for the federal government for providing that assistance to school districts. So at this point, it looks like level aid. However, we do know that the governor now has the ability to look at revenue on a kind of a quarterly basis, if you will. I think April 30th and then again June 30th and then at the end of the year.
Yeah, right.
And the division of the budget can adjust accordingly, how much aid is going to go out. So there really is, again, uncertainty there. The other issue is whether there'll be another federal stimulus and whether or not that would provide additional aid to schools that might help carry them over. So this is in some ways reminiscent of what we saw in the Great Recession in 2008, 2009, 2010, when we saw 3 consecutive years of billion-dollar cuts to schools, but the federal stimulus package really saved the day back then. So far, it's saving the day, at least as we speak now, but that could be, it could be changing, as we go forward. And I'll also point out that schools, even though you could say they were kind of spared any significant harm in the budget that was passed because they did get level funding, you keep in mind that school expenses do go up,
Right.
Health insurance costs, personnel costs, other costs. And so even with the level funding, if you look around the state, you're going to see districts are starting to talk about laying off employees. Those conversations, unfortunately, are probably going to happen. And if there are, any type of additional cuts down the road based on not enough revenues coming into the state, then we'll likely see more cuts. Schools will also, I'm sure, be using their rainy day funds. So at this point, there's just a whole host of intangibles, that are up in the air that we don't know the answer to. And I think schools are being conservative and they're not banking on money coming in that they just don't know, if it's going to arrive.
So you think there will be layoffs? Any prediction of what % of teachers? I assume it varies district to district, and some districts are going to struggle a lot more than others with this.
Yeah, I think it is too soon to say. I do think we will see layoffs. The other option here is, again, going back to the Great Recession, is that we saw negotiations. So if a district were about to, negotiate a contract with one of its collective bargaining units, or if they wanted to open up negotiations. We did see some discussions where maybe employees for 1 year, they gave up, a step increase, or they gave up a merit increase.
Right, you're saying freeze teacher salaries, which Governor Cuomo's doing for state workers right now, a 90-day temporary freeze. So that's one possibility you see as happening.
Well, I think that would be done on a district by district basis. So it would be, local. It wouldn't be a statewide thing. It would be if a district and its collective bargaining units wanted to open up and have those discussions, it'd certainly be up to the school board, the administration, and the leadership of the union to make those kinds of decisions. I'm saying we did see that happen back in, 2008, 9, 10, and it did result in significant savings for school districts. As I said, I'm sure districts will be using rainy day funds, and we all are hoping for an additional federal stimulus because there is so much uncertainty right now over the state aid picture.
Well, I feel like this interview has just been very grim with all the things we've been talking about. Is there anything positive or something that you think maybe schools or school boards have learned by suddenly having to shut down, doing things remotely? Are there any signs or lessons that you're learning?
So what I would say, I think one of the positives to come out of this whole experience is we really see how important school districts are to their communities. They really are, woven into the fabric, if you will, of their communities. And what I mean by that is we are seeing districts arranging for childcare, as I said before. They're providing meals, they're running buses, and they really are an important part of the community. And I think their mission is extending beyond just educating students, but serving the whole community. And I think that's probably one of the few bright spots that has come out of this experience.
Well, on that note, we'll end then. Thanks very much. Really appreciate it.
My pleasure.
Thanks to Karen for that interview. So for the last 3 months, I've been talking to people here at the state capitol about the so-called Death with Dignity movement. Supporters of that movement want terminally ill people to have the option to end their own life with medication prescribed by a doctor. That's currently not allowed in New York, but lawmakers say they're closer than ever to making it legal. Here's what they told me.
Brittany Menard knew she would die in Portland, Oregon when she moved there 6 years ago.
Brittany died November 1st of 2014.
Brittany was diagnosed with an aggressive form of brain cancer earlier that year and told she had 6 months to live. So she packed up her bags and moved 600 miles from her home in California to Portland, where she planned to spend her final days. It's not that Brittany dreamed of living in Portland, it's that state law in Oregon would allow her to end her own life before the cancer killed her. That wasn't allowed in California at the time. Her husband, Dan Diaz, said they agreed to move right after she was diagnosed.
We lived in California, about 30 minutes outside of San Francisco. And on New Year's Day, after receiving that horrible news of the brain tumor, and after she endured an 8-hour brain surgery, when they told her she had 6 months to live, Brittany then decided that we would move to Oregon so that she would have this option.
Now Diaz wants the same option for people living in New York. He came to Albany recently to push legislation that would allow terminally ill patients to end their own life with medication prescribed by a doctor. The practice is called something different depending on which side of it you're on. Supporters call it medical aid in dying. Opponents refer to it as physician-assisted suicide. Assemblywoman Amy Pollin sponsors legislation that would make it legal.
For anybody to say that this is suicide, these people who have who have cancer, who have brain tumors, want to live. They don't want to die, but they don't want to be in pain at the end. And it's just, to watch someone you love die like that, it's something that will live with you for the rest of your life. And you never want to see anyone you love or anybody who you care about go through that.
Pollin has a personal stake in the issue. She went through something similar when her sister died from ovarian cancer a few years ago.
When my sister was dying from ovarian cancer, she yelled out, "When am I going to die already?"
Paulin said her sister might have suffered less if she had been given the option to end her own life. She sponsors the bill with Senator Diane Savino, a Democrat from Staten Island. Savino said it's been difficult to win support for the measure.
There really hasn't been that much movement in either house on it, and it remains a very controversial, sensitive topic that most legislators, when they see me coming on it, kind of want to run away. If they can avoid this right now, they would rather avoid this conversation, like most people. Nobody likes to talk about death. Nobody likes to talk about, end-of-life planning, and legislators are no different.
Most Democrats in the legislature are either against the bill or haven't taken a position publicly. And they're not alone. A handful of groups have been to Albany this year to lobby against it. Kristen Hansen is an advocate for the Patients' Rights Action Fund. She also lost her spouse to brain cancer.
After a seizure unexpectedly sent JJ to the hospital, we were told that he had the deadliest form of brain cancer, glioblastoma, and that he only had 4 months left to live.
Hansen and her husband asked for a second opinion from another set of doctors who told them he would have more time with treatment. They decided to give it a shot.
He responded beautifully to treatment and ended up having 3.5 years beyond his diagnosis. During that time, we created priceless memories with our son, and we welcomed a second son into the world.
But Hansen said things might be different if her husband had been allowed to end his own life with medication prescribed by a doctor. The bill would allow that option for patients with less than 6 months to live. Hansen said her husband would have been eligible.
But if assisted suicide had been legal in New York at the time, JJ could have had the lethal pills with him during his 5th month of treatment, when he questioned whether we'd all be better off without him, fearing he was a burden to me and his family.
The bill is also opposed by the Medical Society of the State of New York. Some doctors say lawmakers should invest more money in end-of-life care instead of legalizing an option to end life sooner.
There doesn't have to be pain at the end of life. I think what we need to look at is how can we get these services more available? We should be asking why they don't have these services. Why don't we have more of these services? And all working together to get the hospice and palliative care services for these people so they can get that comfort at the end of life.
But supporters of the measure say it's not an either-or situation. Dan Diaz said terminally ill patients should have access to pain management and hospice care, but also have the option to end their own life when they want. His wife was treated for pain and used hospice care before deciding to end her own life. Having both options made her final days comfortable, he said.
Brittany, when we got to Oregon, she had to find and establish that medical team, and these were clinicians. Her primary care doctor, he was a Harvard-trained physician, so this is top-notch care. But she applied for medical aid in dying just so that she would have that option if things got bad, if things got to the point where modern medicine cannot keep her from suffering. And unfortunately, that's how things played out.
The legislation wouldn't allow someone who's terminally ill to automatically receive life-ending medication when they ask for it. It would have to be approved by 2 doctors and 2 witnesses to make sure the patient can consent and doesn't need mental health treatment. There are other protections in the bill as well, but opponents say they're not enough. Catherine Carroll is the Director of Advocacy at the Center for Disability Rights. She's worried people will abuse the law and choose to end their own life the moment they develop a disability from their disease.
There's this phrase, better dead than disabled. And you can see in the way that people interact with us that that's really how they feel, that it's a tragedy to acquire a disability, and that somehow we're lesser. Really, and along with that tragedy comes pity and a feeling that our lives are not as valuable as the lives of people who are non-disabled. And that shows up in the reasons why people seek assisted suicide.
For now, the bill doesn't have the votes to pass in either the Assembly or the Senate, and it hasn't moved yet this year. It's stuck in the Health Committee in both the Senate and the Assembly. Assemblyman Richard Gottfried said he supports the bill, but that the votes aren't there to move it in his committee.
Well, I'm not only chair of the Health Committee, I'm a co-sponsor of the bill. I think it's a really important question of human dignity and human right. In the past, we haven't quite had enough votes to get the bill reported from the committee. We're hoping that this year we will we will be able to do that.
It's the same in the Senate, where the Health Committee is chaired by Senator Gustavo Rivera.
Well, it's a legislation that I've supported for the last couple of years, and I'm working along with the sponsor, Diane Savino, to see what things need to be done to it to potentially move it.
There's still more than a month left in this year's legislative session. That's a long time in Albany. Savino says hearing stories from people who've lost a loved one could win votes for the bill before the end of session.
And you don't want to have to see that in your constituents' lives, but it's a reality that people face every day. And that, I think, is more persuasive than anything any of the rest of us can say.
If it passes, New York would be the 11th state with the option. For Diaz, it's personal. He promised his wife Brittany that he would continue pushing for states to legalize the option before she died more than 5 years ago.
It's also the way that I honor her legacy, and to be honest, there's a little bit of therapy in it for me, that I remind people of a courageous, determined individual who just saw an injustice in the way that her end of life was playing out. And she decided to do something about that, even as she was dying, and speaking up for the rest of us.
We'll leave it there for this week's edition of New York Now, but please remember that we're providing daily coverage for you on our website at nynow.org. And follow us on social media at nynow_PBS. Until then, thanks for watching this week's New York Now. Have a great week and be well.
Funding for New York Now is provided by WNET.